So here is the first blood test, which we started to analyze last time. This is, I think, the same person. And here we see how much the liver has suffered from the use of such bad water. The liver enzymes are listed here, and you see that the GGT, gamma G transferase, GGT, is up here at 456 when it should be around 30 or so. And the bilirubin here, total bilirubin, is at 2.4, and it should be no higher than 1.0. And that, once we see that, we have a flag going up, because that is the beginning of jaundice. And we know that we have only 1 week, as a rule, before that will be up at number 10 or so, and the patient will be quite yellow. Mm-hmm. And in another week or so, it will be doubled, and in another week, doubled again. So you see it runs away with the patient and with the clinician, so that you tend to feel pretty hopeless about it. But this project right here that we're putting on this video is to let anybody cure this in a matter of days to weeks.
Mm-hmm.
The other liver enzymes are much too high too, because the liver has been suffering. Here is the alkaline phosphatase at 1531, the LDH, which is lactic acid, 417, when it should be about 120 or so. The alkaline phosphatase should have been around 75 or 85. Here's the AST, and here's the ALT, both much too high, 253 and 175, and both of them should have been around 30. So you see, whenever a person is quite advanced in their cancer, it isn't just one thing like jaundice that happens. The whole body is suffering, and you need to be able to pick out what the highest priorities are to cure. Going here to his hemoglobin and white blood cells and platelet count, those are 3 more pieces of data that everybody needs in order to be sure that they are not causing an emergency. Mm-hmm. You have to deal with emergencies first, and that becomes perhaps a clinical problem. If you need a transfusion, it's certainly clinical. But if you're still not at the clinical level, you can fix it yourself quite quickly if you know how to analyze the problem, and that's what we're going to demonstrate right here.
Okay, continue.
So it's been about a week, or a little less, when we did the next blood test, because these are very critical items that you certainly want to be able to follow and not miss some sudden emergency. So this is done on 11/12, which is 6 days later, and theoretically we should have done it sooner, but we knew that we would be able to cure this rather quickly, and that's why we waited for 6 days before doing the next test. And also, as soon as you start to detoxify the patient, you would expect many items to get worse, because the body has already reached the limit of its detoxifying ability. And to take the problem items out of the body before the kidneys can get rid of it, or the liver work on it, means that the toxin is going to have to accumulate somewhere else, and it will, and we don't want to be suddenly faced with an emergency at a different organ.
Mm-hmm.
So we choose what the most important item is on blood test, and in this case, and any case where the bilirubin is over 1.0, to my mind, you jump to the treatment of the liver, and that's what we did in these 6 days. We first of all opened the kidneys with what we call kidney drops, and that's a procedure that takes about 2 days for each item. 2 days of kidney drops so that they have 2 days of cleaning themselves up. You see that the white blood cells are being fed during this time, and they can clean their own white blood cells up. They can get rid of the things that have been clogging the kidneys, which is all these things: dyes, heavy metals, asbestos, PCBs, and all the other things I mentioned. If you check into a kidney cell, you see that's what's in the kidney cells, and we have to get rid of that first. You do that with giving simple kidney drops. And we have a kidney set. Could you show us the kidney set?
And all of these things we're testing and verifying with the synchrometer, which is something Dr. Clark invented some time ago. And she uses it on all of her tests. It's a very accurate thing. It's accurate 10 to the minus 15th of a gram. And it's, as she said, an instantaneous testing device that needs to be developed and understood by the rest of the world. It's very effective, very sensitive, and extremely accurate in the hands of a good user. So here we are with a couple of kidney bottles, and those are kidney drops, left kidney and right kidney. We do it in 2 parts so that we can get the kidneys to flow adequately before they continue to get further loaded with detoxified material from the liver itself. He's going to explain the kidney drops, and go ahead, Sylvia, you're on.
Okay, the kidney drops has 5 bottles. One is left kidney, right kidney WBCs, which is the white blood cells. Left kidney WBCs, and the lymph.
Very good, thank you.
Yes.
This is how the way I give the drops to the patients. I make sure the patient open the mouth so I can see how many drops I'm going to give to them. And then I count 1, 2, 3, 4, 5, 6. After that, I wait 1 minute. I already have my wash there, so I can see the wash. After that, I continue with the next one.
And these drops actually should go under the tongue, between and behind the teeth.
1 minute in between. And it's for 2 days. For 2 days, and after the 2 days, you do it 3 times.
We're back with Dr. Clark again, and she's continuing.
What we did for this jaundice patient is give him drops that would clean the kidneys just like Sylvia described. So he was very busy with his caregiver giving him the drops because he wasn't quite able. In about 1 day, the kidneys are so much better that we could start him on taking heavy metals out of the kidneys, and that is more of a stress on the kidneys, but the kidneys have just...
Okay, first of all, I give him the kidney set and lymph. After I finish with that, I give him dyes out of kidney set and lymph. After that, I give him the heavy metals out of kidney and lymph. Then after the kidneys are clean, we are continuing by we can continue by with the other issue, what is the liver. We can be focused on the liver by giving him the left liver set, which is a bigger set, and then after that the heavy metals out of.
Could you go back to where, and after that, plastic?
Okay.
Then I give him blueberry grease out of liver.
Hold it, just repeat.
Then I give him woolberry grease out of kidney set and lymph. And then after that, I give him the plastic Bloomberg grease plastic.
Okay.
I give him plastic and rubber out of kidney set and lymph. And that is the last one. After we can continue with the next step, which is focus and the liver program.